All right. Hello, everyone. A very warm welcome to all of you. Is my voice audible, Murdula?
Yes, you are quite audible.
Thank you very much. Warm welcome, everyone. After labor ward prioritization is the second session and the second most important topic for your exam. I'm sure that you all would do great. The idea behind that is to make you learn the points for the feedback.
Hello. Hello.
Hello?
Yeah. Am I audible? Actually, Dr. Sidra
Yes,
is not
absolutely.
audible.
Absolutely.
Yeah.
Am I audible?
Yeah.
Yes.
Okay, great. So what I was saying was that after labor ward prioritization, this is the second most important topic for all of you. And make sure that you get the best of the feedback for this. Yeah. Thank you so much. Thank you. Over to Murdula, please.
Yeah. Okay. Okay. So, yes. Hello, friends. So, shall we start?
Yes, ma'am.
Yeah. So, who is our volunteer today? I think Nazia was about to present, right? Nazia, are you there?
Yes, ma'am.
Okay. So, unmute yourself. Yeah, you are unmuted. Also, start your video if you don't mind, please.
Yes, ma'am.
Yeah. So today we are going to do this, as Dr. Sidra said, this is another important station that you get almost in every exam, that is pre-operative list prioritization, gynae pre-operative list prioritization. So today we will be doing this station. 2 minutes will be the reading time. If anyone is new for this part 3 MRCOG format, so see, you will get a station. So 2 minutes will be there. Yeah, hello.
Ma'am, can you
So
start
outside.
my video?
Huh?
My video. Can you start my camera? It's saying it.
I can start your camera. I don't know. I will see. I'm not able to start your camera. You have to start yourself, my dear, I think. I'm not able to start.
Okay, ma'am.
Yeah. Just try. If it's possible, okay. Otherwise, let it. Okay.
Ma'am, Not the yet.
Host has disabled the video. That's why nobody can start
Oh,
the video by themselves. Yeah.
oh, okay. Host has disabled the video. Yeah, just
Yes.
1 minute. RFA team, please just see that. Because I think my video I was able to on. Okay.
Your video is visible. However, I think
Yeah,
for
that's
the
it.
part.
Yeah. Yeah, I think I could start. Okay, no problem. If they are starting, it's okay. Otherwise, we will continue like this. Okay.
Okay, ma'am.
So, yeah, today's our format will be 2 minutes will be the reading time. Okay. Then 10 minutes you will be performing the station. After that, I will give you the feedback for the station. And then we will discuss important points and tips and tricks about how to go about this pre-operative ward list. Okay. If you have any doubts, okay, just what you do is don't ask anything in between the station while Nazia is performing. That is, give her complete 10 minutes to perform. Whatever doubts you have, we will discuss after she has completely performed the station. Okay. Yeah. So, yes. Nazia, are you ready? So, this
Yes,
is
ma'am.
your station. Yeah. Yeah. I think the slide is visible. So, I'm starting your time, 2 minutes reading time. Okay.
Okay.
Nazia, time is up. You can start.
Okay, ma'am. Hello, I'm Dr. Patel, one of the doctor. Hello, I'm Nazia, one of the exam candidate today, and I've read the pre-operative list today, and I'm ready for the case-based discussion.
Okay, doctor. So as you can see the list, you have to prioritize the list and talk about the management plan for each patient.
Okay, I will, before going patient-wise, I would like to see for every patient that proper consent has been signed and patient has been informed about all the risk factors and alternative procedure. Pre-operative.
Yeah. Actually, you have to go directly to the patients and talk
Okay.
directly with the patients. Yeah.
Okay.
Talk about the patients directly. Okay.
Okay.
Don't go
So
to the
first I will
general.
go for each patient and then I will prioritize at the end. So my patient number 1 is 45 years old, has been listed for endometrial ablation, and her BMI is 36, which is on the higher side. So, and she had ultrasound 5 months back, and her complaints are heavy menstrual bleeding. So I would like to ask her history because there are risk factors about her BMI and her age. So I would like to ask about her history, that for how long she's having these symptoms, any pressure symptoms regarding any effect on her bowel or bladder, and how's she bleeding? Is she using any kind of hormonal treatment? Her previous obstetrical history is given, and her family history of concern, right? Any history of cancers of endometrial or breast cancer in the family. And I would also like to ask about her medical surgical history, any concern, and her personal history regarding smoking and her BMI. Has she able to reduce her BMI? And also, I would like to have a journal physical examination. I would like to have to see her vitals, her abdominal findings, and her per-vaginal findings for bimanual examination. Regarding the investigation, I would look into the baseline investigation. Her pre-anesthetic consent has anesthetic assessment has been done or not. Her her consent has been signed, and her ultrasound has been repeated or not, as she has a history of previous failed marina. So I would look into the that her marina was ultrasound guided or not, and I would also look into the for her HB is optimized. So regarding the management, her alternate treatment has been her fertility desires, and I would also opt for her alternative management has been discussed or not. Okay. Now, my second patient is 55 years old for vaginal hysterectomy with anterior repair. I would like to ask about her history findings, that for how long she's having this symptoms. Is she having for how long she's having symptoms of prolapse? And as the uterus is 12 feet size, so abdominal hysterectomy has been discussed or not. And regarding her history, I would like to ask about her pressure symptoms, her menopausal history. And I would also like to ask about her family history of concern, history of any endometrial or breast cancer, uh, previous medical history, and as she's allergic to penicillin and erythromycin. So, what type of medicine has been given or not regarding the antibiotic cover? And as she has a history of bilateral knee replacement, so I would like to ask about VT assessment and her blood group, any resolution for the blood to rule out any Jehovah's Witness. And I would go for examination, her journal physical
Nazia,
examination.
yes, your connection is right, no? Because people are saying that voice is not good. I
Ma'am,
can hear you properly. I can hear you properly. You can
yes,
continue,
ma'am,
but I don't.
there was other mic that was
Yeah.
on. That's
Please
why.
mute everyone. Yes, I have muted other people. Yeah. Yes, you go on.
Okay.
Yes.
Okay, so I would like to examine her journal physically, systemic examination, like regarding abdominal, as her uterus is palpable. So I would like to see her uterus size position. Now, I would also like to examine her pervaginally and perspeculumly because she's a case of prolapse. And regarding the management, I would look into the consent, informed consent has been signed or not. and her blood baseline investigation has been sent or not, and her hemoglobin has been optimized, and or her baseline investigation has been done, and as she's allergic to penicillin and erythromycin, so other antibiotics, that is cephalosporins, have been suggested and started, and she's assessed for VT, that is because she is having a high BMI, and her risk factors for PH has been briefed or not. Now, regarding my patient number 3, that is, she's listed for hysteroscopic myomectomy with morcellation, as she's a nulliparous. So I would like to ask her fertility desire and her findings, that for how long she's having this bleeding, and her loss, her flow, and how her periods, her future fertility desires, her fertility treatment, if any. Has she used any kind of hormonal treatment so far? And regarding her family history of concern, any history of endometrial cancer or breast cancer or ovarian cancer, and I will rule out polycystic ovaries, and I will also look into the medical history and surgical history if anything, any allergies or any. I will also rule out Jehovah's Witness, and regarding the personal history, her smoking and other personal history and housing support. Now, regarding the management, I would look into the pre-assessment anesthetic fitness has been given or not. Her HB has been optimized already. So I would like to ask my consultant if the blood has to be arranged or not, as she's a high risk patient of having hemorrhage, and her antibiotic has been started or not, consent has been signed or not, and pre-anesthetic assessment. And I would also check that WHO safety checklist um, has been observed. And now regarding my patient number 4, that is, she is patient reconstruction of old labial tear, and her interpreter is there, but it's in hurry, and there is a language problem, but she is having difficulty in wearing tight clothes. So I would like to ask if her vaginismus has been discussed with, has been diagnosed or not, and has she been given other alternative methods regarding cognitive behavior therapy or other management. I would like to review her history for how long she's having this problem, and I would rule out the female genital mutilation, as she's from outside from the UK. And I would also like to ask about domestic violence or any vulnerable factor in her personal history. I would like to ask her family history and medical, surgical, and look into her examination finding, uh, journal physical examination, her systemic examination, her per-vaginal examination. I would also like to have a review with my consultant, because she might need more counseling and more alternative management regarding her labial symptoms. Now, my room number 5 is she's a patient of for laparoscopic tubal sterilization, and she has a prosthetic heart wall. So I would like to ask her cardiac opinion has been taken or not. Her pre-anesthetic anesthetic fitness has been done or not. And she's on anticoagulants, so her surgery has been planned. So she has been converted into from heparin, what she's taking at the moment, her medical history, and for how long she's on anticoagulants, and her VT assessment has been done or not. And all other contraception were offered, but why she was declining all the options, have alternative methods has been discussed, all risk factors has been discussed or not. All the MDTs involved or not, her cardiologist, anesthetist, her interventionist, hematologist is available or not, and her blood has been cross-matched or not. Now, regarding the prioritization, my first priority is room number 5. That is, she's a patient of prosthetic heart walls. So I would first prioritize this patient, because she's a patient of prosthetic heart walls, and all the doctor's team should be ready for it. And then after ruling out all allergies, my second priority would be room number 2, as she's having allergy to penicillin and erythromycin. And she has a hysterectomy with anterior repair. It's a complex surgery with high BMI. So there's more complexity. And then my priority would be room number 3. That is, she's a patient of hysteroscopic myomectomy.
Time
And
up, but yeah, but
oh,
finish your priorities.
and
Okay, yeah. Prioritization. Yeah.
my fourth priority would be room number 1. And regarding room number 4, I would like to consult my consultant regarding her alternative options for her and regarding interpretive. Thank you.
Okay. Okay, thank you, dear. It was a very well attempt, actually. Thank you for performing this, and definitely you did very well, and definitely it was a very good attempt. But yes, there are a few things that I would like to tell you. But before that, what you did good is, yes, you started information gathering. You gave your maximum focus on the information gathering, right?
Yes, ma'am.
See?
I was confused that
Yeah.
I was lacking something or something. I was lacking management, I think. And I
Yeah,
was focusing
actually,
on
yes.
history and examination all over, I think.
Yeah, moreover, you were concerned more about the domain of information gathering. Okay. In that, what was happening is it's not that like you don't know, you don't have knowledge, you have complete knowledge, but you were missing on very important points of some patient safety and communication with colleagues. Okay. So see, there are four domains, and you have to get 2 out of each domain, correct? Pass for 2 marks or 2 points for each domains to get 8 points, right? Okay. So yeah, you are doing information gathering for almost all patient very well, and you were doing spending a lot of time for each patient on information gathering. Like for first patient, you gave 3 minutes total. Okay, out of 10 minutes for first patient, only 3 minutes. And I think according to you, it was not a priority patient, right?
Yes, ma'am.
Yeah. So see, this is a prioritization list. It is like same as that of a labor ward prioritization. Okay. So maximum points will be there for your priority patient. Okay. It's because you have to tell a lot about those 1, 2, or 3 patients more. Okay.
Okay.
And then the rest of the patients, you have to just simply tell the basic management. Got it? Like
Okay.
if as you are going, so now first what I will do is giving you the key. I will just like to tell you that. So you first started with the general template, right? Like you started that for all my patients. Okay. So yes, general template is good, but every time the examiner will not be in the mood of listening general template. Okay, because there are certain centers where the examiners don't want this general template at all. Okay. Like
Okay.
for all my patients, I would like to take consent. I would like to go through their records. I would like to see this and that and all that general things they don't want. Like as I told you, go to the directly to the patient and talk patient specific things. Okay. Got it? So
Yes.
in that case, yes. Now, when you are told that you have to go patient specific, now what you have to do, as you have you have spent your 3 minutes in the first patient talking each and everything in the information gathering. Okay, right from obstetric history, this thing, that thing. Okay, all the history template you were talking about an examination part, right? So in that case, what you have to do is basically you have to decide what are the patient specific points for that case. Like when I'm talking, see what I have decided here, priority wise key is my first patient will be patient C, number 3, who is having hysteroscopic myomectomy with morcellation, correct? Because that patient is having large fibroid polyp, right? And here the most important information given there is only one morcerator is available and which is required for in the OP also, right?
Okay.
Yeah. So now what you have to decide is when this morcelator is only one, so you have to think of the procedure also, you have to think of instrument availability also, you have to think of personal availability also, okay? So like this is a managerial skill, okay? This is not only the patient management skill, but it is along with that, you have to do this managerial skills also, okay? So like you have to decide now what we have to do. So here, as only one morcelator is available, either you can post this patient first or you can post this patient last. Right?
Okay.
Yeah. So now, if you post this patient last, this is a important patient. This is a high risk patient, correct? Because she is having a large fibroid polyp and even her hemoglobin is less. Okay. So she has a high risk of bleeding and she's nulliparous patient, right? So here first in the information gathering only, like always whenever you're talking, you have to talk about the this thing first S-bar format, okay? Like I will like to prioritize my list, okay? And in that, after ruling out latex allergy, that will be your first sentence if you want to prioritize first, okay? Like if you want to start with the priority and management, then you have to talk after ruling out latex allergy for all patients. Am I clear about the first sentence?
Okay,
After
ma'am.
your introduction, okay? So I would like to prioritize this gynec list, keeping patient safety as my first priority, okay? So my first patient, after ruling out latex allergy for each and every patient, my first patient will be room number 3, who the patient name is C, who is 32 years old, who has been posted, who is nulliparous and posted for hysteroscopic myomectomy because she is having a large fibroid polyp with distorted uterine cavity. Her hemoglobin is less, that is 10. Patient is suffering from irregular vaginal bleeding and she doesn't want to have this hysterectomy. I want to keep this patient first because only one morcelator is available and also because the patient is having a large fibroid polyp. She is having a high risk of bleeding. Okay. So for this patient, first, I would like to confirm her ultrasound findings. I would like to rule out the Jehovah's Witness that you already told. I would like to know about her fertility wishes. Correct? I would
Yes.
like to see that her blood is available. Okay. Then now remember that this is a myomectomy, hysteroscopic myomectomy. Sometimes it may require a 2-stage procedure. Okay. So I will also talk about 2-stage, take consent about 2-stage procedures if required. Okay. And also, I know that she wants to avoid hysterectomy, but I will confirm that consent for hysterectomy has also been taken. And also, I would like to explain her regarding the complications like fluid overload. Okay. So whatever I'm talking is that procedure and patient specific. I'm not talking about the routine things. Okay. Routine patient safety factors. You understood?
Okay, ma'am.
Okay.
Like in
So
assessment and then recommendation, you are talking about recommendations.
yes, recommendation and that to patient, very much patient specific, not a general thing. Like I would like to rule out allergies. I would like to rule out this thing that is thromboembolism. I would like to know her BMI is already given. So basic things I'm not talking here. I'm talking very much patient specific. So this is for my first patient. Got it?
Okay, ma'am.
Clear? So second patient will be, yes, definitely laparoscopic sterilization because she's no, please unmute, please mute yourself, all others, okay? Yeah. So my second patient will be patient E who has been posted for laparoscopic sterilization. Okay, here your S-bar. Again, S-bar is very important. So my second patient will be 34 years old, para 4. She has been posted for lab sterilization. Now tell here what are her risk factors. So after talking about the S-bar, talk about the risk factors. Okay. Here my patient is having prosthetic heart valves, which is that's why she's on anticoagulants. And also other risk factor is she is a case of 3 previous cesarean section and her BMI is 35. So these are the 3 high risk factors in her case. And regarding her sterilization procedure, she has been offered about all other contraceptions and she has declined. So first I would like to know, because she is on anticoagulation, as you said, MDT involvement is very, very important here. So I would like to see whether her cardiac fitness has been taken, whether the hematologist is involved in her care, whether the breathing has been started or not. Okay, this word is very important, right?
Ma'am, breaching.
Breathing anticoagulation.
Yes, yes,
Okay.
bridging. Okay.
Yeah. Yes. So with the breathing anticoagulation, because already she has been posted for tomorrow, that means breathing must be started. Correct? Sorry, today. So breathing must have been started. So I would like to see regarding her breathing details. And as the breathing has been started, we have to follow a certain timeline. So that patient should be second on my list. Okay. Here you will involve all your MDTs as you told. And next thing, what is, because she is having a previous 3 cesarean section with high BMI, I would like to involve my consultant. I would like the senior most person should perform this surgery because she is at risk of entry related injuries because of her BMI. So I would also like to see that alternative entry technique like Palmer's point will be used in her case. Because of previous 3 cesarean section, there is also risk of injury to the organs like bowel, bladder, or ureters. Okay, in her case. So consent for that should be also taken. Right?
Okay.
So all these things should be included. Okay. So again, you got it. So these things, patient specific things, you have to talk in that 1 to 1.5 minute. Okay. No other things, that is detailed information gathering, not required here. Got it?
Okay, ma'am.
Yeah. So now your third patient will be vaginal hysterectomy.
Yes.
Yes. So this is very important thing is for any laparoscopic sterilization, rule out pregnancy, do urine pregnancy test. Okay. Inform about the risk of failure of sterilization, and ectopic pregnancy and reversal difficult reversal. Right. So this will come in all sterilization cases. This has to be talked. Okay.
Okay.
Right. Then next patient will be your vaginal hysterectomy. So this patient, now again, you are going to talk about what are the risk factors. So this is a patient who has been posted for vaginal hysterectomy with anterior repair. And the risk factor in her case will be her high BMI. She is a case of 2 previous cesarean section. There is history of bilateral knee replacement and her uterus size is large, that is 12 weeks. Correct? So first, you want to know whether the procedure is appropriate for this. Okay, whatever the procedure you have selected, whether it is appropriate for this patient. So first you would like to know what is her reason for vaginal hysterectomy. So as she has been posted for anterior repair also, you want to know what's her POPQ classification. Okay. Then very important thing, she is a case of bilateral knee replacement. So here your communication with colleague is important. It is not always anesthetist only. Got it? So here you want to know the orthopedician opinion regarding her need of lithotomy position. Clear?
Yes.
Yeah. Then because of high BMI, definitely she is at risk of VTE. So use of VTE prophylaxis according to the Caprini score. During surgery, use of pneumatic compression stockings. Because she is allergic to penicillin and erythromycin, you will document all the allergies, keep a sticker, red sticker or red label, and use alternate antibiotics, right? Then because of previous 2 cesarean section, there is a risk of bladder ureteric injuries. Because of large uterine size, you may have to convert this procedure into the open surgery, right? And then specifically for this vaginal hysterectomy, during procedure, to prevent vault prolapse, either you would like to do McCall's scaldoplasty or sacrospinous fixation depending upon the vault level, correct?
Yes.
And then for hysterectomy, all hysterectomy, you would like to know whether her smears are up to date and normal. And as it is a VH, you want to, and postmenopausal patient, you want to know regarding the ovarian removal if patient has consented for.
Okay, ma'am.
Got it? Yeah. Then next patient will be your endometrial ablation. Yes, it is a day care procedure. Now remember again here, you have to remember whether this procedure is appropriate for this patient or not. Because what they have given is the USG is 5 months back and which is having 2 fibroids, both are 30 millimeters size, right?
Yes, ma'am.
And uterine size is also around 10 weeks, correct?
Yes, ma'am.
So, yeah. So now remember for your endometrial ablation, what is the contraindication? Fibroid size more than 3 centimeters is contraindication for endometrial
Yes, ma'am.
ablation, right? So,
Yes.
and even uterine size more than 10 weeks is contraindication. So here you want to confirm, you will request whether she has undergone already a recent USG, whether your recent USG findings are available or not. To confirm the uterine size also and fibroid size also and also location. Because you cannot do endometrial ablation for submucous fibroid, right?
It was written, it was intramural. That's why
Okay. No, but then again you have to confirm it, recent
yes.
USG, okay? Because it
I
can
told
become
that.
submucous.
Yes,
Yeah,
I
you
told that
told
at the
recent
count.
USG.
Yes.
Yes, you
Yes.
told recent USG, but then you have to specifically tell that if it is not like if the fibroid size is more or this thing, then this procedure may not be appropriate for her.
Okay, ma'am.
Okay. Huh? Then if her recent USG findings are available and she is a candidate for endometrial ablation, yes. Then now as all other things are good for her, only thing her high BMI is the problem here now, right?
Yes, ma'am.
So here first, yes, you want to see endometrial biopsy if it is required. Okay, you want to know the endometrial thickness, whether she requires any endometrial, whether she has any high risk factors for endometrial hyperplasia. And you will request for endometrial biopsy before going for endometrial ablation, right?
Okay.
And then, yes. Now, if the previous Mirena is removed or not, that you would like to check for instrument availability, and you will counsel her regarding while doing taking consent, avoidance of future pregnancies, because if there is pregnancy occurs, there are complications in case of pregnancy, right? And
Okay, ma'am. Ma'am, one
regarding
thing I want to ask.
yeah.
It was written that it was a failed Marina. So I thought that Marina is not inside.
Yeah, failed Mirena means Mirena
It
is
was
not
written failed
this thing,
Marina.
no, it is not useful, but so that confirm it.
Okay.
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 Yeah. Yes.
Okay.
Then
Okay.
patient for whatever you told was very much right. Okay. So first is that the interpreter is in hurry, that you have to address that issue first. So see that the professional interpreter is available because she is Bulgarian, right? And if the professional interpreter is not available, you are going to postpone this procedure. Okay.
Okay.
If the professional interpreter is available, then yes, definitely, as you told, you want to rule out the FGM. You want to know what are the reasons for her labial tear. You will involve experts, that is basically your consultant and plastic surgeon also. Okay.
Okay.
And then, yes, tell her that as she is more worried about her cosmetic results, tell her that cosmetic results may not be always guaranteed. Okay.
Okay.
And it is a labial tear, yes. Always see about in the risk here will be bleeding, and another thing is urethral involvement. So if you're doing the procedure, take care of urethra, do the urethral catheterization. Okay.
Okay, ma'am.
So clear? So this will
Yes,
be
ma'am.
your priorities. Okay. Now, when you talk about this individually, now see, I have not included any general points here. Got it?
Yes.
So if you can finish, you will finish this around 1.5 minutes for each patient. Okay, so you will
Okay.
finish this in around 7.5 minutes. Then now for each and every of my patient, I would like to introduce myself. I would like to review her notes, confirm her history, any change in her complaints. Okay, then I would also like to know her important safety points like any allergies, what is her BMI, whether the thromboprophylaxis is needed, whether what is her blood group, whether the blood reservation has been done, whether she is a Jehovah's Witness. Okay. If there are any comorbidities, I will see for the comorbidities control and involvement of the concerned specialties. Okay. For hysterectomy patients, I will like to see that smears are up to date. For all reproductive age group, I would like to confirm their LMP and rule out the pregnancy. Okay. Then I would also like to rule out any hormonal treatment or smoking history, and if it is positive, I would like to see whether it has been stopped 4 weeks prior to the surgery. Okay. Then for each and every patient, I would like to know whether she knows regarding the indications, why she is undergoing this surgery, what are the risks and benefits, and what are the alternative options which are available for her. Then I would like to explain to her in short about the procedure regarding her post-procedure care enhanced recovery program. Okay. So all these things, and in the communication with colleague, remember that it is not only your consultant and anesthetist, you have to involve your theater nurse, theater managers, and all other respective specialties as and when the patient comes. Okay.
Okay, ma'am. Ma'am,
So-
one thing I wanted to ask,
Yeah.
we have to prioritize first.
Yeah, because why prioritize first, I will tell you. You can do that. You can tell patient-wise also, but then you don't get the time, okay, for prioritization. As happened in your case, hardly less than 1 minute was remaining when you started prioritization, and already you rushed to that your patient 5.
Yes. Okay.
Got it? So it's better you start priority wise, because see, in outside 2 minutes, what you have to do is basically, you have to read the cases. You will understand, write the priority on your book. Okay. You will understand while reading only. Same as thing as you do in your labor ward prioritization. Outside 2 minutes, remember the priority. Okay. Write down the priority numbers on your book, and then once you go inside, you start priority wise, so that you will get more time for your priority patient. Okay. And even if you rush through your non-priority patient, doesn't matter. Please mute. Please all of you, please mute yourself. Okay. So getting me?
Yes, ma'am.
Okay. And now coming to the tips and tricks, how you are going to do this this thing, prioritization or anything. So always remember that your prioritization station will start with the sentence that after ruling out latex allergy for each patient. Okay. Now, suppose what if any patient has latex allergy, then what you are going to do?
Latex will be the first one.
Yeah, first one. And what other precautions you are going to, because there was one station where the patient has latex allergy. So now what you are going to talk about that?
She will be first on the priority
In
list.
latex, we have to operate, we have to take the operation theater on the first basis. And we have to take precautionary measures like anti-allergics and everything.
Your crash card should be ready, okay, regarding for if any anaphylaxis occurs. That is a very important thing. See that all materials, okay, all materials are latex free, all surfaces are latex free. Like your anesthesia workstation and everything. Okay. So everything should be latex free. All catheters, all tubings, whatever, all gloves, whatever you are using should be latex free. Another thing, when the patient is in the recovery or preoperative area, okay, so better to, instead of shifting her to the recovery area, keep her in the OT where you have everything latex free. Okay, because again in the recovery area, you may find, because latex particles are in the air, right? So instead of shifting her to the recovery area, it's better to keep her in the theater itself where you have already arranged everything latex free. Okay. So if that latex allergy patient comes to you, you have to talk about these points, okay, regarding the recovery, regarding the pre-operative preparation, intraoperative preparation, and keep crash cart ready regarding if in case anaphylaxis occurs. Okay.
Ma'am, after the surgery, the latex allergy patient anyway moves to the post-op recovery, right? So what do we do there?
They should not be actually go. They should not go to that area, because again, latex particles will be there in air in that area.
So they'll be directly moved to the post-op ward, is it?
Yeah, directly move to the ward. So for recovery period, they will be in the theater only.
Oh, okay.
Okay. Which theater is arranged as latex free. Okay. In that theater. Okay.
Okay.
Yes.
For
Now,
the-
next thing. Yeah.
For the applied knowledge, the previous slide, can we see it again?
Which one? Applied knowledge? Yes, yes. One second.
Previous slide.
Yeah. 1 minute. This one?
Yes. Thank you.
Yeah. Thank you. Okay. Now coming to the prioritization, whenever you get any 4, 5 numbers, remember, see that if there is any 2 weeks pathway case, that is malignancy case. Okay. If any suspected malignancy or any malignancy case, that should be the first on your list, or any pregnant patient. Okay. Comorbidity patient. Hello, please mute yourselves, dear, please. So remember that. So your malignancy patient should be first on the list. If not, you're pregnant. If any pregnant patient, like for cervical cerclage, molar pregnancy, if those are there, they will be on the list. If any bleeding patient for evacuation, okay, right, retained products of conception, she will be first on the list. Comorbidities patient, like here any diabetic patient on insulin pump, as here you have this prosthetic heart wall patient, okay, those will be first on the list. If nothing like this sort of patients, like any malignant patient, any pregnancy patient, these are not there, then remember that your daycare patients will be, if you have a routine list, then your daycare surgeries came precedence. Okay, because they have to be discharged on the same day. So finish it early and discharge them early. Got it? So if you don't have any other high risk patients, routine patient, all are routine patient, then daycare surgeries take precedence.
Ma'am, can I ask one question? So
Yes.
regarding this last point that you've told, if there's a lady with vaginal hysterectomy and another lady with just laparoscopic sterilization, so the laparoscopic sterilization or any diagnostic lab should be the last, right? Though it
Last
is a
one.
daycare procedure, but here the VH lady has to stay in overnight, and
Yeah.
the other one is a daycare surgery. So
Yeah.
as you said, it should be the last one, no, not the third or the first one.
Lab sterilization, when there are other patients like malignancy and comorbidity, then they should be the last one. Okay.
Okay, but you said daycare procedures should be done early so that they can be discharged early.
When I'm saying this, when you don't have such patients, like patients with multiple comorbidities, see, if you have a routine VH patient,
Okay.
routine vaginal hysterectomy patient and a lab sterilization. See, again, what I'm trying to tell you is the surgeries which can be postponed. Okay. Postponing the surgery doesn't cause any problem. Like lab sterilization, if it gets postponed, it is not going to cause any harm. But VH, if you postpone, it may cause harm. Right?
Yes. Okay.
Yeah. So you have to take that also into account. Okay.
Okay. Okay.
Yeah.
Thank you.
Yes. Now, whenever you're talking about each and every patient, start with S bar. Okay. Then give importance to the safety points related to that specific case. Don't talk about allergies, BMI, GHOAS, blood group for all patients. Not at all required. Okay. Like here, she was talking about vaginal examination, previous surgeries, all these things, not at all important. Okay, what you have to do is you have to talk about very much specific points for those patients, and all those general points, keep 1 minute at the end to talk about the general points. Got it? So that what was happening here when Nazia was presenting, actually she was trying to include everything, but while including that, while talking about all the general points, she was forgetting very much specific. Like she forgot that only one morcelator is available. She forgot here that knee replacement has been mentioned in that VH patient, right?
Yes.
Yeah. So those things should not occur. So keep attention to the points which has given specifically in that station. You have to talk about them. Even if you forget about BMI in one patient or allergy in one patient, which is non-specific, which is not mentioned there. Got it? Okay.
Yes.
Ma'am, I wanted to ask a question about
Yes.
knee replacement. So generally, if there's a hip replacement, we talk about cautery being placed at the back because it's generally
Yeah.
placed or the pad is placed on the thighs. So is it
Yes.
something with the knee replacement as well?
Yeah, in the knee replacement, so because it is a metal prosthesis, no, you cannot keep that plate near that metal, right?
So ma'am, we can't use bipolar there, no? We have to use monopolar only, right? As far as I understand. Okay.
No. Bipolar
Is
you
it?
can use. Monopolar you should not use because patient is a part of circuit.
Oh, okay.
Okay.
Yes.
Yeah,
Yeah.
but
Yeah.
monopolar also you can use if you use the plate near below the hip or in the near below the back. Okay, not near the thighs.
Okay.
or near the calf. Okay.
We have to
Okay. Okay.
ma'am, we have to mention this point.
Cautery placement, if it's better if you mention. Okay.
Oh,
Okay, ma'am. And also regarding her mobility issues, whether she can walk or like,
Yes.
because she's
Yeah.
having bilateral knee replacement.
Yeah. Knee
Yeah.
replacement.
And will
And
that,
another thing. Yeah.
ma'am, will that modify her lithotomy position as well? Like in bilateral hip replacement, the lithotomy position might get.
That's
So
what.
we
No,
need to
that's why.
allocate the staff.
That's why we have to take the orthopedician opinion, because you may require to modify that lithotomy position by the
Okay.
orthopedician opinion, whether she is a suitable candidate for lithotomy or not. Okay.
Right.
Okay.
That's why
And
you have to
ma'am,
take.
regarding
Yeah.
endometrial ablation, we have to also talk about the post-op where she have to avoid pregnancy. So shouldn't we talk
Yes.
about contraception in that?
Yes. Use of contraception. Yes, definitely. Okay.
Okay.
Avoid pregnancy, and for that use of contraception, because it is not a this thing, it is not a sterilization operation, right? It is not a sterilization. It is not going to make you, or there is nothing is like a permanent sterilization here. So there are 1% chances of pregnancy even after endometrial ablation. So she has to use effective contraception, right? So here same thing. Okay. Now again, never ever forget the domain of communication with colleagues. And whenever you're talking about the communication with colleagues, remember that it is not always only anesthetist and your consultant. You have to include the relative specialties. You have to include your theater nurse, your theater manager, all these people. Okay.
okay, ma'am.
And you have to talk about the important post-operative precautions, as she mentioned here, like use the this thing, use contraindication for these people. Okay. For this endometrial ablation, for a hysteroscopic myomectomy, avoid pregnancy for next 6 months, right?
Yes,
Yes.
ma'am. And ma'am, regarding that lady with reconstruction of old labial tear,
Hmm.
don't we have to, like, if it is some kind of vulval reconstruction or any labial refashioning, isn't
Hmm.
it not allowed until the patient's mental health is affected or she has significant issues? So
Yes.
shouldn't we
So
include that while we are saying,
mental
or
health also, yes, that is also very important. So always include this mental health professional. So that's why you want to know why she wants to want this labial reconstruction. Okay. If it is a simple labial tear and this thing because of any FGM or this thing, then yes, you may have to reconstruct it, right? There may not be total mental health issues. So because it is a cosmetic reason and all these things, yes, if she has any mental health issues, you have to address them all. Okay.
okay. So in that case, we can reconsider and get a consultant opinion whether the procedure was actually
Yes.
needed.
Yes, that's why.
Okay.
That's why you have to involve your consultant, you have to involve your plastic surgeon, okay, and all these things.
But ma'am, in
Okay.
this labial
One thing I want to
reconstruction,
ask, what did you mark for my station? Was it
Okay.
a flea?
excuse me, ma'am,
Yeah. Your
I can ask
information
one question
gathering,
to
I would
you.
like to give you two. Okay.
Okay.
Coming to the patient safety and applied, it was 1 month communication with colleagues. Very few things you mentioned about communication with colleagues. So overall, it becomes a borderline dear. Okay.
Okay, ma'am.
Excuse me, ma'am.
Okay. Yes.
Can I ask one question? Ma'am, in this labial reconstruction patient, it is mentioned that she is not able to wear the tight clothes. That was the reason it is given. So
Hmm.
even though we have to ask the mental status.
Yeah, because see, she is not able to wear tight clothes and she is worried about the cosmetic results. Okay. So that might be also a mental health, because you don't know exactly what it is, correct?
So how we will ask for the mental health in this case?
See, now it is a structured discussion. You are not going to ask to the patient. Okay. So I would like to also rule out any mental health problem for this patient. That's enough. Okay.
Okay.
By involving
Okay.
related mental health
So we
specialties.
can say
Okay.
that in liaison with the
Okay.
mental health services will not be involved, right, for this particular thing?
Where? For this patient?
Here only, in liaison with the mental health services, that won't be required. That becomes too extreme, right? In
No,
liaison with mental health services for this patient with the labial tear. Like we're
yeah,
assessing a mental health.
Yeah, you can assess her mental health, and if she has a valid reason, there is no need of mental health. Okay. So that's why
Okay.
very important thing is you want to know why, what is the reason for her labial tear. Okay.
Mhm. Okay.
Yeah. Okay. So anything else?
The
Yeah,
slide.
ma'am, in bridging anticoagulation, that will be a priority case. Like if
Yeah.
everything is regular, bridging
Yes.
anticoagulation becomes a priority one. Okay.
Not before bridging hysteroscopic myomectomy because of the morcellator basically here. Okay.
Mhm.
Otherwise, the
Okay.
bridging will be the first. Okay.
Right. Okay. All
Because your
right.
time constraint will be there for bridging patient. Okay. And
Okay.
hysteroscopic
Yeah.
myomectomy, it will be a short, you have to finish it within 20-25 minutes only.
Mm-hmm. Okay.
Yeah.
All right.
Yes.
Can you show the
Okay.
slide for applied clinical knowledge again?
Yeah, I will show you. This one. Wait. What is happening? Just 1 second. Yeah, this one. No? This one?
The next one. Not the.
Next one is applied knowledge only.
Yeah.
Yes. Yeah. So yes, any other doubts, dears? Any other things you want to know regarding this preoperative list?
Endometrial ablation, before that, we have to definitely take an endometrial biopsy, right? It is not considered,
Yeah.
but it is recommended, yeah?
Yeah, endometrial biopsy should be taken.
Okay.
So yes, any other doubts do you have?
Ma'am, then the post-op care we have to tell for each and every patient?
No.
Or in general, in the last, we can say?
In the last, you have to talk, and only any important post-operative precautions. Like for this hysteroscopic myomectomy, you have to avoid the pregnancy for 6 months. For that, even endometrial ablation, avoid pregnancy, use contraception, right?
Yes.
These are the few things where specifically you have to talk about the precautions. Okay. Like if any cervical circlage patient is there, you will talk about the further this thing precautions. Okay.
Okay.
Ma'am, regarding the information gathering, can we ask just like labor ward prioritization information from the examiner directly for each case?
Now here only what you can do, sometimes the examiner may have extra things. Okay. So just I would like to know if any other extra findings are there. Okay.
Like this only. If he does not have any extra findings, then we will say in general, like in this case scenario, we were saying that we will exclude this, and this. But if he
Yeah.
has extra findings, he can tell us one by one, right?
Yes. When you start talking, no, when you will say that I would like to rule out any allergies, then definitely the examiner will say that no, this patient has penicillin allergy. Got it?
Yes. Like this. Okay.
Okay.
Ma'am,
Hmm.
before prioritization, we have to mention that we will confirm the consents of all the patients. So we have to
That's what I'm
mention that
telling you.
point, na?
No, what happens, if you start talking about the general template, no, it becomes a problem. Sometimes the examiner may like, sometimes examiner may not like. Okay.
Okay. So we can just ask like latex allergy and consent
Yeah.
will be
See,
asked after that.
Yeah, generally what you can say is I would like to prioritize this gynae preoperative ward list, keeping patient safety as utmost priority. Okay. So
Okay,
after
ma'am.
ruling out latex allergy, I would like to see now the patients are posted for the surgery, correct? So that means consents are taken, that is implied. Only thing at the end, I would like to confirm consent for each and every patient. Okay.
Okay, ma'am.
Yeah.
Thank you.
Yes. Okay. Any other questions?
No, ma'am.
Okay. So shall we end the station? Hope it was useful for you. Just
Yes, ma'am.
Yes,
Very
the
useful,
recording
ma'am.
will be
Thank you so
available,
much.
dear. Recording will be available. Okay. They will make it available. Okay.
Thank you so much, ma'am.
Thank you. Thank you, all of you. Thank you,
you,
Nazia,
ma'am.
once
Thank you,
again for
ma'am.
presenting.
Thank you,
Yeah.
ma'am.
Thank you,
Yes.
ma'am.
Bye, bye, girls. Bye, friends.
Thank you, ma'am.
Thank you.